Well, it's important in all of these things, and this is also true in the prevention space. There is a tendency to emphasize pharmacology when in fact we also need to understand the role of lifestyle. And right now, tobacco cessation, exercise probably has as big an effect on outcomes as any drug we've ever had. So getting people to exercise an appropriate amount every week, which generally is considered 150 minutes of moderate exercise or 75 minutes of intensive exercise, is critically important. Diet, we tend to recommend the Mediterranean diet because we have the best evidence for that. And so I hope that as we think about prevention, that we not just focus on the pharmacology. There's a sign somewhere in the Cleveland Clinic by the stairs that say, this is a free, therapy. Just walk up the stairs. And, it's great advice. And we get more patients to do that. I'm very worried about the obesity epidemic. That's the one where we haven't made any progress. So we've got to keep our eye on the ball. Yes, we need better drugs, and we're getting there because of the new guidance. But we also need to really emphasize lifestyle, and physicians have to be better and more proactive. We need effective strategies for getting people to change their lifestyles. So far, we haven't been very successful. The obesity epidemic is getting worse, which is why diabetes is continuing to increase in our developed countries and now in the developing world. Well, we have some clinical trials that we're completing. One of them is a trial of a highly modified omega-3, a fish oil type product that's designed to be better absorbed. We have a recent trial called Reduce It, which had promising results. We have a somewhat larger trial that we're completing sometime in the next year or so. And we're looking forward to the results because these drugs are targeted at lowering triglycerides. And triglycerides are now emerging as a very important risk factor. It is not just about LDL cholesterol. Triglycerides are important in cardiovascular risk, and we're now developing therapies that will target elevated triglyceride levels.